Hello, I'm Dr. Neetu. We were discussing about ischemic heart disease, and in the last video, we have discussed about angina in detail. If you haven't watched that video, please go and watch that video. Today, I'm going to discuss about myocardial infarction, which is one of the most important topic. So let's start. Myocardial infarction, commonly called as heart attack, which occurs when blood flow to a part of heart muscle suddenly gets blocked, leading to ischemia and irreversible myocardial cell death. Pathophysiology behind myocardial infarction is first, an atherosclerotic plaque gets accumulated in the coronary artery, gets ruptured. Then this leads to platelet aggregation. Then the platelets will cause thrombus formation. So the blood flow gets blocked in that area. So this leads to oxygen deprivation. Finally, myocardial necrosis. So more prolonged ischemia means prolonged myocardial damage. 90 to 95% of this MI cases are due to atherosclerotic coronary artery disease, and the most commonly affected artery is left anterior descending artery. This is the most commonly affected. Left circumflex artery and right circumflex arteries also get involved in myocardial infarction. Next common cause is coronary artery spasm. This is a temporary spasm of coronary artery leading to reduced blood flow. This is mainly due to cigarette smoking, then cocaine use, then stress, and the spasm which is seen in Prince metal angina. This is another important cause of myocardial infarction. Next common cause is coronary embolism, that is reduced blood flow due to an embolism. This is mainly seen in atrial fibrillation, then infective endocarditis vegetations, then prosthetic valves, etc. Another cause is coronary artery dissection. This is actually a tear in coronary artery walls. So when a blood enters the vessel wall, the lumen compression occurs. This is mainly seen in pregnancy, then postpartum, in young women, etc. MI can occur even without a blockage. That is, in cases of severe anemia, then tachycardia, in case of stress, then severe hypertension. Even without a blockage, MI can happen, and this is often called as type 2 MI. MI can occur even in certain coronary artery procedures or trauma, that is, in case of angioplasty procedures, cardiac surgery, blunt chest trauma. In these cases, also MI can happen. Then another cause is drug-induced myocardial infarction. That is, some chemotherapeutic drugs, then cocaine, etc., can cause MI. Some rare causes of MI include Kawasaki's disease, vasculitis, etc. So that's all about the common causes of myocardial infarction. Now we can move on to the types of myocardial infarction. Two types of myocardial infarction, that is STEMI and NSTEMI. STEMI means ST elevated MI and NSTEMI means non-ST elevated MI. I have clearly discussed about these two, STEMI and NSTEMI, in the ECG series. If you haven't watched that video, please go and watch all the 3 videos in ECG series. So in case of STEMI, there is complete coronary artery blockage. That is transmural ischemia occurs. So ST elevation on ECG. In case of NSTEMI, only the partial occlusion, that is subendocardial ischemia occurs. So we will get an ST depression or T inversion on ECG. The clinical symptoms of MI include, initially there will be a premonitory pain, that is a worsening of angina or angina even during minimal exertion or rest. Then unlike angina, MI can occur at rest in the early morning. Then the pain of infarction, there is acute chest pain worsening within a few minutes, that is tight sensation, that is elephant on chest feeling. Then patient places fist on chest, that is Levine sign. It is accompanied with sweating, nausea, vomiting, palpitation, etc. The important thing is that atypical or silent MI can be seen in diabetes, elderly patients, then in women, etc. That's all about the clinical features of myocardial infarction. Next is ECG changes in myocardial infarction. That is, it is a classical evolution. First, we can see hyperacute T waves, then ST elevation, then comes pathological Q waves, Finally, T wave inversion. Next is cardiac biomarkers. First is troponin I or troponin T, which is a more sensitive or specific test. That is, troponin is a contracted protein which is not usually seen in serum. It is released when myocardial necrosis occurs. Next cardio biomarker which is raised is CKMB, that is creatine phosphokinase, which is useful for reinfarction. Finally, the complications of myocardial infarction. MI can lead to arrhythmias, heart failure, cardiogenic shock, then pericarditis, aneurysms, Dressler syndrome, etc. Hope you understand about the ischemic heart disease, that which includes angina and myocardial infarction. If you like my video and if you understand video, please like, share and subscribe my channel. Thank you.